Mr. Wald. Just before we begin, by way of reminder, tomorrow I'll be holding a closed session in the morning to hear evidence from Cabinet Office and the Department of Health and Social Care witnesses. This means that there will be no attendance from members of the public, and there will not be the usual broadcast of inquiry proceedings or publication of a transcript. Core participants will be able to attend and to be represented at tomorrow's hearing, and some media representatives will also be present. I've imposed these restrictions at the request of the National Crime Agency so that the inquiry can consider evidence relating to PPE MedPro fully without any danger of prejudicing future criminal prosecutions. But these restrictions are only temporary. They will be lifted as soon as the prospect of any prosecutions is resolved or prosecutions that are brought are concluded. Once I've finished the hearing of evidence in closed session, we shall revert to open session tomorrow afternoon for the last remaining witness for this week. Mr. Wald.
My lady, before we commence, a small matter of housekeeping from me as well. In the course of yesterday's evidence, Lord Agnew raised a matter of commercial sensitivity in respect of which we seek a restriction order.
Very well. Thank you. Sorry to keep you standing, Lord Bethell. Welcome back.
Thank you. My lady, our first witness today is Lord Bethell.
I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Thank you.
Please state your full name for the inquiry.
James Bethell.
Lord Bethell, thank you for providing to the inquiry a witness statement. It's inquiry reference 000528392, which you have signed. Please confirm that it is true to the best of your knowledge and belief.
Yes, it is true.
Thank you, Lord Bethell. I have a limited number of topics which I wish to address with you over the relatively limited time that we have together this morning. Before doing so, can I just touch upon your background and then onto your role during the pandemic, if I may? You entered government as a whip in the House of Lords in the middle of 2019, is that right?
That's right.
Your responsibilities included ones within the Home Office and the DHSC.
And also the Treasury.
And the Treasury. On the 9th of March of 2020, you were appointed as Parliamentary Under-Secretary of State for Technology, Innovation and Life Sciences. Your portfolio included data and technology, NHS IT and data to support innovation.
That's right.
And you, of course, maintained your seat in the House of Lords and continued to be involved in House of Lords business.
That's right.
Thank you. Then moving on to your role during the pandemic, Lord Bethell, by March 2020, you had an extensive portfolio of responsibilities, which you list at paragraph 9 of your statement. And that portfolio included the supply of medications, testing technology, test and trace, research and life sciences, including vaccines, which of course was the reason why you appeared in Module 4 earlier this year, global health, security, international diplomacy and relations, NHS IT and data and technology. Is that right?
That's right. There were further responsibilities later in the pandemic, including the red listing programme.
And by red listing programme, do you want to just explain what you mean by that?
Yes, the programme for closing the borders and ensuring that people who arrived in the UK were properly tested.
All right, well, we won't move on to that in the course of our time together this morning. Your ministerial responsibilities largely centred around testing, is that right?
I wouldn't say largely centred, it was one big aspect of it.
You describe your role as acting as a liaison between industry and the government.
The role was bigger than that. It included providing ministerial oversight of the testing programme.
Yes, I'm taking this from your statement. So if it requires adjustment, then of course please offer that. You say you were often brought in to engage with industry and energise their support for the national response, and to encourage the private sector to come forward with their best ideas and resources.
Yes, that's right.
All right, let's move on then to early stages and the setting up of the so-called GO team. You were involved in the setting up of an initiative that became known as the GO team in the early days of the pandemic.
Yes, that's right.
Now, the GO team, was that essentially a team based at the GlaxoSmithKline headquarters, which sought to find promising suppliers of key medical equipment and supplies?
So there were a number of teams which had different names at different times. It is true that the Glaxo and AstraZeneca companies provided a huge amount of logistical and logistical support and advice, but they weren't the only team that were helping us.
No, I wasn't suggesting that they were, but have I correctly summarised?
Yes, you have.
The function of the GO team? And you explain at paragraph 20 of your witness statement that this would draw on their intelligence and market muscle to access the best suppliers to work in parallel and directed by the NHS procurement team, with a particular focus on ventilators, PPE, cardiovascular medicines and testing kits. What do you mean by drawing on intelligence and market muscle?
Yes, so at the very, very early stage, when they were their most valuable, the NHS procurement system was under huge strain, and parts of it, including SCCL, completely fell over. We needed their team of procurement experts who had access to the data of what was available in the market to literally provide, as it were, a catalogue of the materials that we might be able to source and advice on where we might go in order to find other materials. I know that sounds rudimentary, but I can't exaggerate how important basic intel on where stuff was at that time.
Were leads passed on to the DHSE and the parallel supply chain, or was this essentially a scoping exercise?
That GO team was not primarily focused on PPE. It was mainly focused on medicines, and I didn't have any engagement with it and don't know exactly what they passed on.
All right. Can I move now, both in time and in topic, forwards to the government testing strategy? That was published on the 1st of April 2020. We have touched on this with a previous witness, so I want to go fairly swiftly, if I may, to the 5 pillars of the strategy. We can look at them very briefly. INQ 000106325, I think it's page 2, that tells us, there they are, those 5 pillars. With which of these pillars were you most involved?
So with NHS, I was involved in encouraging the NHS to step up to the biggest ambition it could find for itself. Pillar 2 became the biggest part of this programme and became NHS test and trace. Pillar 3 was very important to begin with, but faded once we realised that just because you'd had coronavirus didn't mean you couldn't have it again. Pillar 4 was very slow to get going, but became extremely impressive. And although it wasn't financially the biggest part, in terms of its intel, was incredibly important. And then Pillar 5 initially was slow to get going, but became a really big part of what I was doing to try to encourage UK industry to source and manufacture diagnostics.
All right, thank you for that. That's the beginning of April. That's the 1st of April of 2020. Matt Hancock announced that as part of this strategy, the government would deliver 100,000 tests a day by the end of April of 2020, didn't he?
Yes.
Did you think at the time that that was achievable?
I did. I encouraged him to step up to that, and I thought it was exactly the kind of big, hairy goal that we needed in order to galvanise the system.
The testing strategy document itself explains that although the UK had undertaken one of the highest numbers of tests in Europe, we had the worst starting point, didn't we?
Yes.
So my immediate question is, can you offer any reflections on why that was?
Yes.
And how difficult it made achieving that target?
So we had in PHE fabulous scientists who were extremely good at the analysis of viruses, but had no ambition or remit for putting together the kind of population health diagnostics that other countries had. That was a very weak platform to build our response on. And in fact, we were essentially starting from scratch, both in terms of testing and in terms of tracing. That meant they didn't have a reach into diagnostic companies in order to source the material. They didn't have a data spine to build on, and nor did they have any local or regional aspect to their test and trace capability. All three of those were substantial weaknesses when we were going to build a national response. And that was why we had to create an entirely new organisation from the bottom up.
So those are the weaknesses. Can I just come back to the other part of my question, which is whether you were able to assist us in identifying the reasons for those weaknesses? Why was the UK an outlier within Europe? Was there anything systemic from which we can learn anything within this inquiry?
I think that public health generally has been underestimated in terms of its value to the country, both in terms of supporting the underlying health of our workforce and of our people, in providing resilience at times of crisis, and also in terms of reducing pressure on the NHS. There is a fundamental misallocation of resources in our health and care system. 3% of our budget, roughly, is spent on public health, and that is much lower than in other organisations. People in public health have got a low status compared to, for instance, those who run acute hospitals. We need to pivot to prevention in a massive way, and this is a glaring example of that.
All right, thank you for that. You tell us in your evidence, it's paragraph 35, at page 12, in March 2020, I produced a memo on how to industrialise UK testing, where I set out the urgent steps to address the issues of limited availability and increase our testing capacity. So I want to hear from you what those key steps were. Can we start by putting up a document that might assist in this regard? It's INQ 000497128.
Thank you. What date was that?
This was in March of 2020, you tell us in your witness evidence. And there are, within this document, bullet points or Roman numerals.
Yeah.
Are these the key steps?
Yes, in terms of creating a UK testing industry, yes.
And these were, you devised these steps?
Working with experts, I was led very much by people who had deep experience of both international diagnostics, which is more ambitious and creative than UK diagnostics, and also those who, in the UK industry who understood where we were starting from.
All right. And how were they received, these steps?
They were received, well, it was very ambitious. A lot of people had hoped that this moment would come. There was a great amount of ambition in the industry to take the UK diagnostic industry, which had suffered greatly from our lack of focus on population health and public health more broadly. And people were up for it and really wanted to see it succeed.
On the 8th of April 2020, the DHSC issued a press release launching an online portal for companies to offer their services to bolster the UK's diagnostics industry. That's right, isn't it?
Yes, that's right.
Was the government flooded with too many offers as a result?
Well, I would just caveat that by saying that we did a number of different appeals for help at different times. Some of them were very, very specific. We did an appeal, for instance, on swabs. We did one on tubes. And a lot of them worked through the industry bodies like the ABPI and BIVDA. And then we did this one that you've referred to, which was more of a public appeal. So yes, there was a huge amount of, an overwhelming amount of interest in it. And we struggled to manage the huge amount of interest. We stood up a call centre to handle it and a web form for people to fill in. But I would say that the practicalities of handling the response were not as well organised as I would have liked them to have been.
Your own words are that you say we are drowning in helpful suggestions.
Yes, I said that to parliamentarians. Yes.
Now, I think just going back to your previous sentence, that your view was that the flow of offers was welcome, but the ability to handle them was inadequate or insufficient. Is that how you view it?
Yes, I think you put it well. I think that I was surprised that a relatively straightforward operational task of canvassing a large amount of interest amongst UK industry and then processing those expressions of interest seemed to be a bit of a struggle for the system to work itself through. I was surprised that it was difficult for us to ask thoughtful, sensible questions, put it into a database, prioritize them, order them, and then target the ones that met the right criteria.
There will always be a burden of triage where offers are invited and are received at a large scale, won't there?
That's right. That's part of the procurement process. In fact, that kind of transparency, particularly at a moment of heightened public concern, is important.
And assuming that no triaging process is perfect, the more specific one can be about the request for and receipt of offers, the better, as a generality.
As a generality, that is true. I would just add, yes, I agree with you. I would just add that it also, though, shook out some quite creative and interesting offers, some of which were distracting, but many of which were helpful.
All right. Let's turn now to the Test and Trace programme.
Sorry, just before you do, I'm sorry to interrupt, Mr. Lord. Going back, Lord Bethell, to your point about canvassing interest and processing interest being a task that systems struggle with, was that because the technology wasn't there? In other words, people were using Excel spreadsheets as opposed to a proper database?
Yes.
Is that why they struggled?
So I think three reasons. One is operational, as you describe. The government is not very good at throwing up a web page in the way that a tech startup might do very easily. Secondly, the industry wasn't used to us actually asking them for things, so they themselves, it took them a while, and they didn't have the expertise, the management depth, to be able to respond to such a large request very easily. And thirdly, what it elicited was that there was a huge amount of diagnostics that we just weren't engaged in, diagnostics that might analyse spit or coughs or poo or dogs or any number of creative solutions that you might mention that the system had never really looked at very carefully. So we were starting from the beginning in terms of building an understanding of what was available.
Thank you.
And in terms of, just to finish on this point of achieving specificity where possible, you refer in your own evidence to the approach of canvassing known industry players, associations, holding round-table discussions. All of those are helpful in relation to achieving a greater specificity and placing less of a burden on the triage process.
Yes and no. When you're doing a public call for a tube, being really clear about what the dimensions of that tube should be is very, very important. But if you're at the very, very early stage, you may not know what you really want. So, for instance, the lateral flow device was not on the agenda at all. It didn't come from PHE as a suggestion. It really was driven by industry interest and sponsorship of the idea. So the round tables and the engagement with industry brought up fresh and new ideas, some of which were not conventionally used by the system.
I was going to come on to it in a moment, but we might as well pick up the point now. You use the word pivot. There are certain industries that, and we've seen it in the evidence that's been heard at within this module so far, that might manufacture one product but would be able to manufacture another in a given set of circumstances. So PPE is an example of that. Clothing manufacturers were able to pivot. Now, we had evidence from Mr. Hall, who was the originator of a rapid response team, and suggested that it would have been preferable if there had been a more targeted approach adopted to manufacturers of PPE or even manufacturers of products that, in relation to which it would have been possible to pivot to PPE, rather than seeking, in rather more blanket or open terms, offers, including ones that were received from those that were no-hopers, let's say. Would you agree with his evidence or disagree with it?
Well, I think that his evidence is true at certain times, but not others. In March and April, when we were scrambling for PPE, there was no question of being able to put together telephone numbers of the 10 big players and phoning them up and say, hi, would you please send us a couple of plane loads of PPE? Because it was such a mad scramble. Actually, we needed to galvanize the entrepreneurs and the buccaneers and the people of extraordinary talents who could somehow get their hands on this stuff and find the angles that would get them back to Britain. And we were competing with New York City mayors who were sending Learjets full of cash to get that stuff off the Hong Kong runway and into their own plane. So no, I don't think at the early stage that lovely rational approach he describes would have been worked. In testing, for instance, the rational approach was to work with Roche, who had the biggest fleet of machines, PCR machines, in the UK. But of course, they couldn't give us any of the reagents, which Bev, I think, explained very, very clearly. So again, we had to open the Overton window to a much broader range of opportunities. And also, the science was changing very quickly. We didn't necessarily know. Now, a gown is a gown, but we didn't know what kind of mask we necessarily needed, what kinds of gloves we would needed. So a lot of the specifications were bouncing around a lot of the time. And I think you have the memo from Mr. Bourne on the difficulties he had for getting a specification, even for a simple tube. So I think that there's a lot of hindsight wisdom that is applicable in planning the future. But at the time, the scramble mode was a necessary feature of our response.
All right, let's turn, if we may, to the test and trace programme and the fast tracking to which you refer that formed part of it. In July 2020, you were asked to lead on the new strategic testing strategy, is that right?
That's right.
You tell us that in October 2020, you started attending weekly meetings to discuss testing suppliers. Is that also right?
That's right.
Some suppliers were designated VIP or fast track or priority. Did you personally have a hand in those designations or in the idea to introduce those designations?
That's not something I had a hand in. I don't recognise a list of VIP suppliers. There was a list supplied by the industry bodies of the people who had experience in that area, and they were naturally prioritised.
Are you therefore unable to help us with what would the basis upon which a particular supplier might or might not be designated a VIP?
I'm not quite sure which list you're referring to.
Well, you say at paragraph 67 of your statement, although there was no separate VIP route or channel for testing suppliers and ministers, were not involved in the evaluation or procurement process for contracts, where emails came from a supplier with an established reputation in diagnostics or related to products or services of which there was an acute shortage, the email could be tagged by the triage team as VIP, fast track or priority.
Yes, that's right.
We can put it up on the screen if that would help.
No, thank you, but that sounds right.
All right, and then I see
it is right. It's from my.
It's been done in any event.
Thank you very much.
There's the bit that I just read, up to priority, and then towards the end of that paragraph, we were invited to mark the email as fast track in order that it could be tagged as such and to help officials to provide progress reports.
Yeah.
Now, this is quite different, is it not, to the VIP lane about which we've heard a fair amount of evidence within this module relating to PPE. It is a criteria-based prioritisation system, isn't it?
Yes, it is.
Yeah. And I understand what you say about the initial scramble, but all other things being equal, that criteria-based approach is a better one if it can be achieved because it places less burden on the triaging process. Well,
yes, what you say is reasonable, but the reason why I hesitated is that even here, I would just point out that in the 6th of April 2020, we thought that antigen testing was going to be the answer. We thought that if we could establish that someone had had the disease, they could then go back into the workforce and be free of the threat of infection. That proved to be incorrect shortly afterwards, and that was a very daunting and terrible moment when we found that out. And therefore, our whole strategy had to move to an infection method, and that's when things like the PCR and the LFD became more important. So you are right that having specifications and criteria are nice, but you should remember that actually the science and the circumstances were chopping and changing all the time and didn't settle for a long time.
So, Lord Bethell, there does seem to be an important distinction between what you are saying in relation to the, I suppose, the uncertainty about exactly what it is you might need at a given moment in time, and therefore the inability, without levelling any criticism of anyone, to be that specific at those early stages, and ascribing to a particular offer priority by dint of who it was that referred it into a particular process. There is a distinction. You don't seem to draw the latter as an example of something that is a reasonable or a desirable method of prioritisation. You give instead, it seems, if I've understood your evidence correctly, a system that either achieves a high level of specificity when it is possible or avoids that specificity when it is not possible. But in none of the situations are you saying that because a referral comes from a particular person or type of person, that offer should achieve any form of priority.
Just pause for your answer, Lord Bethell. I'll give you time to think. It was a very long question.
I know.
I'm just wondering whether you've entirely represented the evidence correctly, Mr. Wald. As I understand it, one of the factors in from whom the offer came, the credibility of the offer, would be that they were a successful manufacturer, maybe in a different field. So it's not necessarily the name of the person or their personal connections. It could just be the credibility of their work to date and their experience. So I think, I'm sure you didn't intend it, but I think your question may have been a bit misleading.
My lady, we've had mixed evidence as to whether any form of triage was done in relation to referrals. Mr. Gove, for example, described himself as a postbox. When he received an offer, he would refer it into the VIP lane without more. Other witnesses, such as Lord Feldman, have given evidence to the effect that some form of triage was conducted at that point. I suppose the more general point is that it was a limited category of person that was able to refer an offer into the VIP.
Yes, I understand. So I think that where there's some confusion is it depends which stage of the pandemic you're talking about. In the later months, when the procurement process was settled, when the strategy was agreed, when we basically knew what we were trying to get, oxygen, masks, vaccines, therapeutics, when the science was essentially agreed and the strategy was planned, then you could have your wonderful specification-led approach. But in April the 6th, we were bouncing around all over the place. We didn't. Half the scientific community thought that the virus was transmitted by touch. And I was being overwhelmed by people saying that they had hand sanitizer, and half the scientists said that we should be deep cleaning homes and offices. So we were in all sorts of confusion about what it is that we actually wanted. I was very close to the meetings and to the discussion around the science. So to an extent, I had in terms of that triaging that you're talking about, if we're talking about early April, then I had about as much knowledge as anyone about where we thought things were going to settle. And so in terms of, if you're talking about April, I would have applied quite a big filter on what was going to come through or not. Later on, provenance does count for something, but not the only thing.
And when you say provenance, the identity of the referrer?
The identity of both the referrer and the source, the ultimate source of whatever materials we're talking about. If someone says Roche can't get through, then I really want to hear about it. And if a thoughtful scientist or a cabinet minister vouches for something, then their mandate does count for something. And in the algorithm, there's a mixture of the two.
Just to pick up on the term fast track that you set out in your written evidence, that doesn't include, I take it, the provision of progress reports or feedback updates.
Yes, thank you for that question. Listen, I wasn't trying to run a sort of British Airways gold card scheme for valued people in the British community. I was trying to make sure that people who had good ideas and good recommendations got through, and the people who were time wasters or fraudsters got turned away.
Yeah. So the management of expectations or the provision of updates would have formed no part of this system. It was a system to identify the good opportunities and make sure that they received urgent attention.
No, I think no, you're putting words in my mouth there. We were trying to give a buy signal. If we're talking about diagnostics, which we are here for the moment, the British government had not bought diagnostics in a serious way in this. We were well known for being diagnostic light. And so major diagnostic companies did not regard Britain as a key customer. So, to use the phrase that was used earlier, we needed to put a buy signal into the market. And so for credible diagnostic companies, we had to reassure them that we were going to be a thoughtful, reliable, pay-on-time customer. So yes, feedback to them was very important. To the time wasters, feedback to say, could you please stop wasting our time and stop writing articles in the Daily Mail and phoning the Prime Minister was also important.
And were ministers actively seeking feedback in this regard?
When there were people who applied with sensible sounding measures, some ministers would not have known the difference between what was a credible offer and not. And yes, they would have sought to get some kind of feedback. But like I said, this wasn't trying to run a concierge service for people so we didn't hurt their feelings. It was in order to run as good a system as we possibly could put together.
I want to turn now very briefly to the high priority lane that we've been looking at more extensively within this module, the one that relates to PPE, for two reasons. One is a very brief one. You draw an analogy or you draw a comparison between other forms of VIP lane, and you give the example of the Ukrainian refugee program. That is or was perhaps is. Is it? It's still
no, it doesn't exist at the moment.
Doesn't exist at the moment. A program by which offers of accommodation could be dealt with on an emergency or a priority basis in order to accommodate those arriving from the Ukraine. Is that right?
That's correct.
It's quite different, is it not, in its nature from the procurement situation that we are dealing with within this module?
It is different, and if I can just explain very briefly, what I was trying to get across is that it is the nature of a minister in any kind of pressured situation to put together some form of engagement with parliamentarians about that issue. In fact, at DHSC, there is a substantial parliamentary engagement team. They used to sit outside my office, as it happened, of I think 20 or 30 people. And sometimes that engagement includes an aspect of operational engagement. So the Ukrainian refugee scheme, there was literally a suite in Portcullis House where parliamentarians could drop in and check up on the progress of their refugees' status. That is an example of where parliamentary engagement was done very, very emphatically. Not every procurement, of course, has that aspect. If the NHS is trying to chase down, as they are at the moment, HRT drugs or trying to buy AI, you wouldn't necessarily have a VIP scheme for that. So in that respect, we were in an unusual position. But of course, this was a huge explosive problem and the system had completely fallen down. So that's why I think it was a slightly different case.
It's a huge explosive problem. There was an urgent need to procure, but there was also, without implying any criticism of those that supplied the urgently needed PPE or other bits of medical kit that were required, there was also some interest or even benefit in being the person that entered into that contract, wasn't there?
Oh, listen, capitalism saved us. If it hadn't have been for the profit motive, we wouldn't have had a vaccine, we wouldn't have been able to stand up extra hospitals, and we wouldn't have had PPE.
And that profit motive was absent in the Ukrainian refugee example.
Yeah, sure, that's completely different.
Yeah.
There were refugees who were desperate to get to Britain, so they were. There was a lot of pressure, and I'm pleased to say we were able to take on board one family, so I'm quite familiar with it.
So we've dealt with most of the points that I wanted to on the VIP lane. I just want to pick up a couple of points that you make within your written evidence. you say at your paragraph 61 that one of the ways that I could be said to have had any role in the establishment of the HPL was by commissioning a working spreadsheet into which updates on referrals could be seen and reduce the need for ad hoc chaser emails.
Yeah.
Now, it was important to reduce that need because they put pressure on those busily, heroically, working hard to achieve emergency procurement, didn't they?
Emily Lawson put that very well, and I thought her testimony was very touching.
So it was clearly a sentiment that you possessed even at this time.
I felt it really powerfully. I was the junior minister in charge, and I felt that I should be a human shield to protect hardworking officials and frontline staff from what was going on in the press and even in their communities, the concern that people had. And so, yes, answering questions from serious senior people was a way of trying to create space for them to get on and do their job.
And for some of those individuals, it was an enormous additional stress and distraction. We know that from written and oral evidence within this module.
It was awful. People were trying their hardest, working absolutely flat out, and they felt that somehow the system was failing around them. And so to try to give them the confidence that there was a plan and that we were moving forward was incredibly important.
Do you think that your working spreadsheet was a sufficient protection against that problem?
No, of course not. What would have been a sufficient protection would have been to have a CRM system that actually worked and hadn't completely fallen over.
CRM?
A customer relations management system, so that we actually knew what was happening with all of the SCCL completely eviscerated. It had no warehouses, no database. The staff didn't have the names of any of their suppliers. I went down to Skipton House to see Emily Lawson on April the 21st, and I saw for myself, I saw the good news, which was Emily and her team were putting together from scratch a completely new system. But I also saw the bad news, which was that it was currently stickers on the wall and whiteboards with circles on it. We were starting from a desperate situation, and my spreadsheet was the beginnings of a proper response.
I just want to probe a little bit further, if I may, this customer relations management system. This would be to siphon off, to protect those involved in the day job of emergency procurement.
No, sorry, if I may. The underpinnings of any business is a database which has all of the orders and details of the suppliers. In the vaccines, for instance, there was an extremely good database where they could track supplies of vaccines coming in, when they were going out, who had done what work. That is the fundamental spine on which any business is built. And at SCCL, that had completely fallen over because they had been running this JIT model, the just-in-time model, and that relied on agents and others doing a huge amount of the work. So they had to start up again. And you'll remember that Emily Lawson talked about at first putting together a Salesforce measure. That then didn't work, and they then had to go to another system. So it was very, very slow to get going. Once it did get going, it worked quite well.
But just staying with this theme, do you think that the ministerial interventions were excessive, that they should have happened less, that one should try and introduce measures to discourage them?
No, I don't. I think that it was a desperate time, and a lot of people either stepped forward because they were extremely well-intentioned, or were keen to get contracts, or a bit of both. And handling all of that interest was always going to be tough and difficult, particularly if, and I'm sorry to use the phrase again, but if your CRM system has completely fallen over and you can't keep track of people's offers of help, then you're going to have a problem on your hands. And I think ministers were doing the right thing to try to lend a hand and provide some operational support.
All right, we're going to turn on to a couple of examples, concrete examples in the form of Mellor Designs and Randox in a moment, and see how that plays out in practice. But before I embark on that, are there any measures that you would recommend in order to achieve that protection that you clearly were trying to do with your spreadsheet of those busily engaged in emergency procurement?
Well, I'm afraid that the answer to that is that I wouldn't have liked to have started from there in the first place. I wish we had had a public health system that was more robust, and I wish that NHS colleagues had had a procurement system that wasn't so focused on just-in-time desirables and keeping as little as possible in the warehouse. So I think resilience does count for something. I also think British industry had been overlooked in diagnostics, in PPE, and in other places. We had, for geopolitical, well, for philosophical reasons, become incredibly dependent on particularly China, but on overseas suppliers. When in fact, as Lord Dighton explained very well, there was huge capability in the UK, and we saw that in the scientific and medical space as well. We should have really had more of an industrial strategy around supporting British industry to be a key provider, partly because they were good at it and it provided jobs, but also when the balloon went up, it was a more resilient way of conducting our affairs.
Can I ask, just pursuing Mr. Wall's line of questioning, I am sure whether constitutionally you could actually stop ministers from, isn't that part of our system, that ministers can ask questions about matters of important public interest? I mean, it would be undermining the Constitution, wouldn't it?
I was up every single day, sometimes 3, 4, 5 times a day during this whole period. Some of the correspondence that we've been looking at, I was literally typing from my iPhone on the front bench whilst peers asked me in very, very clear terms what we were doing. And specifically, I was asked, why were we allowing red tape and regulatory hurdles from getting in our way? And shouldn't we, and I was giving reassurances to peers from all parties that we were doing absolutely everything we could to meet the urgent need. So yes, this was a very live challenge that I had in Parliament, and parliamentarians made it absolutely clear to me that we should be doing everything that we could to meet the frontline needs of our doctors and nurses for PPE.
I suppose the only question, Lord Bethell, is who is at the receiving end of those requests? Is it the same person that is triaging, that is sifting through offers, that is processing offers? Or can it be, and it sounds like on occasion it was in your own case, someone else who is not doing that day to day and can therefore spare those who are involved in that activity
Yes, good
from
question.
dealing with both things at the same time?
So there was a massive capacity problem. We didn't have enough people. And Bev spoke very well of how she had come over from Cabinet Office. I would have liked an army of 50 Bevs. And if I'd had that, it would have been a lot easier, as you just described.
All right. Let's turn on then to one of the two examples that I said we'd go on to relatively briefly. Could we have displayed up INQ 000497141, please? Now, on the 6th of April 2020, your private office emailed Joe Churchill's private office to relay that you'd been contacted by David Mellor of Mellor Designs, about whom and which the inquiry has already heard some evidence in the course of Mr. Gove's appearance here. Mr. Mellor was asking for a letter of intent for the purchase of 35 million face masks. Do you recall this particular offer?
I remember, yes, I do.
David Mellor was a friend or a great friend of Michael Gove's. The email from your private office asked for the request to be actioned as soon as possible, as Lord Bethell, it says, has given David Mellor assurances that it will be dealt with.
Correct.
Yeah. The email is presumably correct. It provides a correct account of what happened.
I'm sure it does.
So you did provide these assurances to David Mellor. Why did you do so in relation to a company that was still undergoing procurement checks and was subject to ongoing due process?
So this question of letters of intent was one that came up all the time. The practicalities are, if you're dealing with a Chinese factory and you're trying to get them to prioritise you over any number of other competitors, including Americans carrying suitcases of cash, then you need to demonstrate good bona fides. And a letter from the UK government of some kind is the kind of instrument you need to make sure that they actually deliver and commit to an order. This was not the only request for a letter of intent. There were a very, very large number of them. And I'm pleased to say that we were able to provide them. That is exactly what, on the 6th of April, given the scramble that we were in, that was exactly what I saw my role as.
Were you aware that Mr. Mellor had made similar approaches to Mr. Gove's office 2 days earlier, and that Mr. Canduff, who headed up the VIP lane, as I'm sure you know, had explained that although there might be pressure to act, it was essential to check the deal, and he noted that although some individuals had identified themselves as ministerial contacts, some of those offers were not genuine, and he refers to noise as a synonym for distractions. Were you aware of any of that?
100% I was aware of. There were plenty of people. Some of them were well-meaning but misguided. Some of them were outright fraudsters. And and we were trying to do our best in an extremely confusing situation. I'd also say that we were trying to galvanise our own civil servants, many of whom, and I'm not speaking about Max at all here, but many of whom were genuinely paralysed by the situation. The system had been put in place for 100 years to stop us from doing this kind of thing. The system put in checks and balances and rigour and audit and regulations of a commendable kind, which I strongly support, but its psychology was to be very, very cautious about absolutely everything all of the time. And what we needed on April the 6th was to take away that 100 years of conditioning and to say, we need to take some risks. We need to lean in. The British public expect it of us. Parliamentarians have told us that's what they expect us to do, and it's the right thing to do. And so this chivying email is an example of where I was taking that spirit into practice.
Thank you. That's very helpful. Could I just ask, you mentioned the checks and balances, the caution, the legacy of the 100 years.
Yes.
I wonder if we can hear your evidence on the approach that you think it is best to adopt, where an offer is received from a person who is a friend or a great friend. Would it be to make mention of that in any referral, but include a caveat that no preferential treatment should be given, to simply make mention of it, or to make no mention of it at all?
Listen, these were mad scramble days. As far as I was concerned, he was a retailer who had 30 years of experience working with Chinese factories and had a credible offer to get face masks, which at that point were like gold dust. And our nurses and doctors needed it. Getting into his personal life history or trying to set myself up as some kind of governance chief would not have been the right thing to do. And I don't think that's what the British public would have expected me to do.
I mean, it wouldn't have related to you, Lord Bethell. I don't think you had any pre-existing relationship with Mr. Mellor.
I know a lot of people in this country, and I've come across David before, but he's not a particular strong contact of mine.
OK. Let's turn on to the Randox case and explore, if we can, helpfully, whether there are any broader lessons to be learned from the experience of that as well. Most pertinently to any issue of perceived conflict of interest and how to deal with them. So on the 30th of March of 2020, Randox was awarded a contract by the DHSC to supply around 2.7 million tests over a 12-week period, as I'm sure you're aware. Mm-hmm. The involvement of Owen Paterson MP with Randox has received a great deal of public attention. And I want to explore, as I said I did, with you what can be done to ensure that public confidence in the procurement process is not lost when there is a perceived or actual conflict of interest, or when elected officials become associated with commercial activities of the government. I hear what you say about the mad scramble, and you will, of course, indicate if you feel that in circumstances such as these there is nothing that can be done to maintain public confidence or to set out guardrails to maximise the prospects of that. So
that's not my...
That's not your view. So you'll indicate what can be done, what should be done.
Yeah.
You describe in your witness statement that you had some involvement in the award of the Randox contract, but you were not involved in the contractual negotiations.
Correct.
Yeah. You describe Randox as a rare example of a large, experienced diagnostic company based in the UK that might be able to produce the tests that we so desperately needed. So it ticks a number of boxes, including some of those that you described a moment ago.
Yeah.
UK manufacturer, without dependence on overseas suppliers?
No, they weren't dependent on, everyone was dependent on overseas suppliers.
Because of the for parts or materials?
And particularly the reagents, yeah.
Okay. What was the size of the UK's diagnostics industry in the UK at the time, as you understood it?
Well, it was tiny and characterised by small science-led operations, often founder-managed, which had a very good reputation in niche sectors, but had no experience or capacity on mass throughput testing, which is what we needed.
Discussions between Mr. Hancock and Mr. Patterson started as early as January 2020, and we know from we're told that Mr. Hancock and DHSC were in discussions with Owen Patterson, who I understand was a paid consultant for Randox. That's from your evidence. When did you learn that Mr. Patterson was a paid consultant for Randox?
Oh, I don't know. It was published in his register of interest, so it wasn't a secret.
You gave your authorisation for civil servants to start contractual negotiations with Randox on the 24th of March of 2020.
Yeah.
On what basis did you approve this? Had you had previous discussions with Randox or with Mr. Patterson?
Well, Randox is the standout candidate for working in the diagnostic area. We had had a lot of problems with PHE and reluctance to engage with the public sector, with the private sector at all, and therefore Randox had tried to communicate as in whatever fashion they could, including through Owen Patterson, their frustration that the coming train down the track was not being handled properly and no one was engaging with them. So what was the precise run up to the signing of the contract? I can't give you chapter and verse off the top of my head, I'm afraid, but they were definitely the biggest player in British diagnostics. So of course we were going to do a deal of some kind with them.
You said that you did a search to establish Mr. Patterson's role in Randox. Did he openly declare that to you as well?
Yes, of course. It's public knowledge.
Did you identify or regard there to have been any actual or perceived conflict of interest?
I think that if someone has put something in their register of interest and are utterly transparent about it, then it doesn't qualify as a conflict of interest. I should also add,
yes,
the information that came from Randox was phenomenally helpful. We were being told by PHE that they were engaged with the British diagnostics industry, and the information from Randox came that they were not. It turned out that Randox were correct, and the information we got from them was of value and helped us galvanise the system.
You will, of course, be aware that the Randox transaction provoked quite a lot of attention, public attention.
Yes.
Do you think there is any way that it could or should have been handled differently?
I think that the attention around Randox has been highly politically motivated. I think it's a great shame that a British company has been demonised in that fashion. Other British companies will take that lesson and be extremely reluctant to step up to the challenge in the future. And I think that it's a great shame what's happened to a good company. And
just returning to my question, do you think there are any measures that could or should be taken to prevent any of that?
Yeah, I understand what you're getting at. We were falling over ourselves to be as transparent and clear-cut and working within the regulations as possible. Everyone knew that there was going to be an inquiry. From the very beginning that this all started off, we knew that we were going to be sitting in a chair like this, answering questions like this. So we deported ourselves accordingly, and we were incredibly thorough. We took the advice of our officials, we gave them the space to tell us when they thought we were wrong, and we were extremely cautious about everything we did. And in our handling of Randox, I think that was couldn't have been a better example.
Finally, Lord Bethell, on the 30th of June, Mr. Hancock asked you to speak to a contact of his, Alex Bourne, to see if he had any useful suggestions about testing kits. Do you recall?
Yes, I do.
Could we just have displayed up on the screen INQ 000 551 393? Short email from Mr. Hancock. I think this is a very interesting critique from someone who's turned his business to testing when the crisis broke. He's a very impressive guy and quite a good analysis. Thoughts? ? Did that suggestion or that description in any way influence your treatment of the HINPAC or Alpha Laboratories offer?
This was a classic offer from a maverick entrepreneur who was stepping up to both the challenge and opportunity that the pandemic was coming. And I read the email, which I thought was very thoughtful, and judged it on its own merits.
You said earlier, in relation to the referrals that came in, the referrals that were made into the VIP lane, that it was a mixture, as you saw it, of the referrer and the supplier when you were assessing credibility. Does it not follow that a recommendation such as this from a person such as Mr. Hancock would carry some weight in addition to the analysis that you obviously did of the email below it?
Well, Mr. Wall, I just mentioned that this email is a very detailed analysis of some of the challenges he's facing. It's not actually a pitch for any work. It didn't have any it didn't have a pitch in it. I think it was sent to me because it explained the problems he was having trying to get a decent specification, and it was a very painful and bold reminder of how problematic, even at this stage, even in June, our own system was proving.
Did you assist in taking the HINPAC Alpha Laboratories offer forward?
It wasn't an offer.
Did it result in any form of contract?
I have no idea.
All right. Lord Bethell, those are all my questions. Thank you very much.
Thank you. Miss Morris, who sits there.
Oh.
Thank you, my lady. Lord Bethell, I ask questions on behalf of the COVID-bereaved Families for Justice UK, and I'm going to focus my questions on the topic of preparedness, about which you've offered some observations this morning already. I think it's quite clear from your evidence we weren't prepared. Is that a fair summary?
I think you put it very well.
Thank you. In your statement, you say that you found it hugely frustrating that our normal procurement system didn't seem capable of securing the vast volume of PPE, and you focused on the fact that it had become increasingly optimised for cost and waste management, but not for flexibility and resilience. Is
Correct.
that something you would agree with? In your lessons learned section, you say that you believe that the biggest problem was that we were lacking when we went into the pandemic. There's nothing in the store cupboard. You said that already this morning. And you've mentioned the just-in-time, the JIT delivery system. One of the things you highlighted was the lack of direct contact with manufacturers. And you said this morning already that there's a number of intermediaries, agents and networks, and there wasn't that direct contact with manufacturers, particularly in the UK. So do you agree that that lack of direct relationships and over-reliance on agents and intermediaries was a fundamental failing affecting the PPE procurement response in the pandemic?
Yes, it was. And if I could mention, we did a large amount of work around Project Defend, which I would recommend to the inquiry, to look at how we could build resilience into the system. And it identified a system which is very well known of ensuring that you have some manufacturers on shore, some in territories where you're friendly with, maybe some that are a bit further reach, and maybe some where you have poor relations. It's creating that network of different relationships which you can ultimately rely upon and also scale if needed. And what was so problematic is that scaling from nothing is very, very difficult. Scaling from a foundation of some kind is much easier.
Thank you. I was going to ask you, kind of, in your opinion, what a more flexible and resilient system would look like. For example, would there be more direct contact with manufacturers? I think you'd say yes, it should be more direct contact with manufacturers. More investment in domestic production, I think you'd agree with that. And a sort of an increase in rolling stock and moving away from just-in-time contracts, that store cupboard being full at the point that you need it. Would you agree with that?
I completely agree. And I would say that resilience is not a mystery. It's not something that we have to think about and design and invent. We know how to do it. It's all been extremely well explained in government policy. but we've chosen not to go down that route. And I think that that is a mistake.
Thank you. My second but connected topic is about sort of sleeping contracts and stockpiling. You said in your statement you don't believe in sleeping contracts. You don't think they'd have a strong role to play in any future pandemic planning. You say it only really works if you know what type of pandemic you're planning for. Do you agree that in 2020 there was an over-focus in planning and preparing for an influenza pandemic as opposed to different kinds of pandemic responses?
In part, yes. There had been a failure to acknowledge the lessons from SARS. I think there was, at root, a philosophical playbook misunderstanding that stopping the progress of the disease was an important part of our reaction. And so that was a sort of fundamental problem. And I think that we have just underestimated the societal lack of resilience we have in terms of volunteers, British industry, the use of data, and we need to think again and take lessons from countries like Finland that have put resilience at the top of the agenda rather than at the bottom.
Okay, but just focusing on sleeping contracts and how they can assist, isn't one of the points of sleeping contracts, or advanced supply contracts as they're also known, is that you can address multiple scenarios because they allow for contracting for multiple eventualities that can be required in certain types of pandemics?
So I was very moved by a conversation I had with a big pharma CEO who told me that in America they had put hundreds of millions of pounds in sleeping contracts, and this company had stood up factories to be ready for the pandemic. And when the pandemic kicked off, it showed that they were the wrong kind of factory. So I am sceptical whether you can be predictive. Where I think you can make a big difference is in warm capacity. So in testing, if you have a system of public health screening and you have mass throughput labs as a result of supporting that ongoing program that has valued in today's world to the health system, you then have a platform that you can scale up to be bigger much more quickly. I think that concept of warm capacity, making sure it's in the right place, is more valuable than cold capacity in terms of your contracts.
But is that not an argument instead for having a sort of a wide range of sleeping contracts and stockpiling that can deal with multiple eventualities, as opposed to just kind of warm capacity for one eventuality?
My experience was that the science changed, the eventualities changed. You know, if COVID had been a slightly different disease in any number of different ways, we would have had a completely and utterly different set of requirements. So I am instinctively very skeptical whether you can ever predict what's going to come down the line. For instance, had it attacked children, our response would have been completely different. Had it been more from touch than from air, it would have been completely different. So it's very, very difficult to predict what the progress of the disease will be.
Okay. Thank you. Thank you, my lady.
Thank you, Ms Morris. That completes the questions that we have for you, Lord Bethell. I'm extremely grateful to you again for your thoughtfulness and for your help. I'm not sure, given your role in Test and Trace, whether I can say we won't be asking for you to come again. So apologies if we do make another demand upon you, but thank you so much for what you've done so far.
Thank you very much.
I think probably take the break now. I shall return at 11:20.
All rise.
Mr. Wald.
My lady, our next witness today is Mr. Matt Hancock.
Repeat after me the affirmation, please. I do solemnly, sincerely and truly
I do solemnly, sincerely and truly
declare and affirm
that
the evidence I shall give
that the evidence I shall give
will be the truth,
shall be the truth,
the whole truth.
the whole truth, and nothing but the truth.
Thank you.
Sorry, we keep asking you to come back.
Would you state your full name for the inquiry, please?
I am Matthew John David Hancock.
Mr. Hancock, thank you for supplying yet another witness statement to the inquiry. I believe it's your seventh. It's INQ 000 536 350. It's signed at the end. Can you confirm that it's true to the best of your knowledge and belief?
Yes.
Thank you for that. I think at this stage, very little by way of background is necessary, as you've given evidence at several modules in this inquiry. Those following will, of course, know that you were Member of Parliament for West Suffolk between the 6th of May 2010 and the 30th of May 2024. Is that right?
That's right.
You were Secretary of State for Health and Social Care between the 9th of July 2018 up until the 26th of June, 2021.
That's right.
You've given evidence, as I say, on a number of occasions. In this module, as you know, we'll be focusing on the procurement and distribution of healthcare equipment and supplies.
Mm-hmm.
So may we start, please, with the stockpile?
Right.
We know from paragraph 36 of your statement that, in your own words, on coming into post as Health Minister, you were advised that the UK was a world leader in preparations for a pandemic.
That's right.
And we further know, perhaps we could have it pulled up onto the screen, from your book, The Pandemic Diaries, that's INQ 000 569 777. The good news is, you say at the beginning of January 2020, good news is we've got 1 billion items of disposable personal protective equipment or PPE stockpiled and ready to dispatch to hospitals if required. It's stashed away at a secret location in the northwest where it's been gathering dust, hopefully not literally, since it was put together in 2009.
Yes, that's a description of what I was told at the time.
Yes, I was coming on to that. You were told that, were you not, Mr. Hancock, by, let's pull this up on the screen as well, INQ 000 184 105. It's page 2, internal paragraph 11. There are specific. The UK is acknowledged as being amongst the global leaders in preparing for a pandemic.
That's right. I'm not sure when this document's from, but that was the standard description given to me. And in fact, you'll recall, my lady, from Module 1, some time ago that we had that I had a day one brief in this area, and I then interrogated that brief and asked a series of questions, and we put in place some further actions as a result.
I was just coming on to that, Mr. Hancock. Did you have any reason to doubt what you were told here?
No, the civil servants give their advice to the best of their knowledge in a high integrity manner, in my long experience as a minister.
It was accepted, presumably, that any stockpile would eventually run out and a need to buy more in bulk would arise. Did you find any evidence of such a plan in place?
No, there wasn't a plan. I first ordered the opening of this stockpile and the ordering of more PPE in January 2020. So it was towards the end of January 2020. At the time, by recollection, this was when Professor Whitty was advising that a global pandemic was a 50-50 chance, and it was looking increasingly bleak in terms of a pandemic hitting our shores. And I think there were a handful, 2 or 3 cases in the UK. That was the point at which I began the process of ordering more PPE.
And more generally, your department was preparing for a potential outbreak of COVID-19 in the UK from as early as January 2020, wasn't it?
Yes. Sir Chris Wormwald moved to being full-time focusing on the potential pandemic in the middle of January I can't remember the exact date. We went through this in Module 1, as I say. But yes, from very early on, we recognised the risk was very significant. And in relation to buying PPE, there wasn't a mechanism in place to buy more. And indeed, the purchasing of PPE was essentially decentralised, with the exception of SSCL, which I know has been discussed in this module. But remember, SSCL only existed to supply the 250 main hospitals, not the tens of thousands of other areas that came to need extra PPE.
I'm coming on to that in a few moments, so
Sure.
if we can park that, I promise I'll come back to it. I just want to continue on the line of questions that I've started with you. Did you ask officials at this stage, we're back in January 2020, when your department was preparing for a potential outbreak, COVID-19 in the UK, did you ask officials to assure you that the PIP stockpile was ready to deploy?
I don't recall if we had a deployment discussion specifically, but that was an inevitable part of using PPE, of course. And anyway, at that point, we had a distribution system to the hospitals in SSCL, which later fell over. So it was about early spotting that we'd need to buy more PPE and about opening up the existing stockpile for PPE. There was a third part, actually, which is important to note, which is that at the time, we'd been preparing for the potential of a no-deal EU exit at the end of January 2020. And the supply chain had built up some stocks, not specifically in PPE, but across the purchases that are relevant in this module. And the advice came to me towards the end of January 2020 to say we should tell industry to reduce those stockpiles. And given the risk of a potential pandemic, I overruled that advice and said we should not request the disbanding of these stockpiles once the risk of a no-deal Brexit had been taken off the table.
Were those EU exit stockpiles able to be to contribute positively to the need that arose due to the COVID pandemic?
Yes, very, very much, in two ways. One, directly, because there were more stockpiles in the supply chain than there would otherwise have been. The second is indirectly, and probably actually more important. It meant that brilliant officials like Steve Oldfield, who had worked on and led that policy, were then immediately able to turn the information about, in particular, the pharmaceutical supply chain, to understand that supply chain better. We just heard from Lord Bethell the lack of supply chain information in certain areas like diagnostics. But in terms of pharmaceutical drugs, and here the critical ones were anaesthetic drugs, although we didn't know it at the time, we knew those supply chains better than we ever had before because of the work preparing to, in case there was a no-deal Brexit. So there was information and actual goods, but it pertained less to PPE and more to things like medicines, as I say.
I asked the question because we heard yesterday from Lord Agnew, who gave his views on whether Brexit planning helped or hindered the task of procurement. I suppose you're offering an example of where it helped effectively.
Yes, it wasn't Brexit planning specifically. It was planning in case we'd ended up with a no-deal Brexit. Right. So, you know, my view was that would not have been a good idea. I was against it, but it was still my responsibility to prepare in case it happened.
I've used the term Brexit planning to include the possibility of
in that case, yes,
a no Brexit, no deal Brexit. Let's just go back to your pandemic diaries, if we may. We go to the other end of the month, 30th of January. INQ 000569777 and page 2. And you say this: PHE's audit of PPE came back and did not lighten my mood. The paperwork is all over the place. There's no clear record of what's in the stockpile, and some kit is past its best before date. I've instructed officials to work out what we need fast and buy in huge quantities.
Quantities, yes.
Now, there's two questions that arise from that. I suppose the first is that you had said I suppose rather jokingly or glibly, that you hoped that it hadn't been gathering dust.
Yeah.
In the event it was effectively gathering dust, much of it had expired, hadn't it?
Yes, I wouldn't say it was glib to say I hope it hadn't been gathering dust. It turned out that that metaphor was appropriate.
Well, you would perhaps say prescient in that case. But the second question I have for you in relation to this is, were you given any explanation as to why it was that some of the kit was past its best before date?
No.
No.
All I would say, the explanations I was given was that the record keeping had not been clear. I wasn't given the next explanation, which is why the record keeping hadn't been clear. You know, to me, I come from a technology background. It's obvious that you need to keep a decent record of everything that you put into a stockpile. I mean, this wasn't the only problem. The bigger problem was that it wasn't pickable.
So adequacy of the stockpile is one issue, but sufficiency is another, and you deal with this in your paragraphs 43 and 44. When you say that both the EU exit stockpiles and the existing pit stockpile were not going to be sufficient or were going to be insufficient to meet the demands of the pandemic,
Yeah.
what is it that you mean by sufficient? Are you talking there about volumes or items or types of items?
Well, all of those things. So you have to remember the context here. January 2020, we in the department could foresee the likely potential, which Professor Whitty put at 50-50, of a global pandemic. We could see, therefore, the immediate consequences. Once you took that risk seriously, and we did, you immediately see a whole series of consequences. And this period, in the last 10 days or so of January 2020, is when we put in place a whole series of actions to mitigate the gaps that immediately became evident. One, having been reassured that we had an adequate stockpile, which you can see in the middle of January and before the pandemic, by the 30th of January, when I asked for the audit comes back and there are serious problems. Two, we did not at that stage know the nature of the pathogen, but we knew that it was obviously very serious because it was looking 50-50 like a global pandemic. So at that point, I instructed that we got going on all the things we needed, including the fact that whatever the nature of the pathogen, we were going to need more PPE because you can never stockpile enough PPE for a whole pandemic. I was told we had around 1 billion items. It was clear to me on some relatively rudimentary assumptions that if the pandemic was, I think at that point, on the assumption that there weren't mitigating factors, that it would last in 3 waves for about 15 weeks each wave. If you put everybody in the health system in PPE for that period, you're going to run through the 1 billion items. So we didn't know the scale of what need would be. We didn't know the nature of the pathogen. But we did know that if there's a 50-50 chance of a global pandemic coming, we need to get buying now. And we also could see that since we were making these decisions in the UK, others would be making these decisions around the world, and therefore there would be a massive crunch. So my instruction was to get going as quickly as possible.
I'm going to move on to that crunch in a moment. I just want to make sure I understand your evidence in relation to never being able to stockpile enough PPE for a pandemic. You mean given limited storage capacity?
Yes, in the realities of the world and in the realities of public finances, I was meaning that colloquially rather than literally. Of course, you literally could, but even with the experience of the pandemic, I'm not exactly sure how big the stockpile is right now. I know it's more pickable and it's spread around the country rather than all being in one big shed, and I hope, beyond hope, that they have an adequate IT system telling them what's actually in there and good records. But over the course of the pandemic, you need billions and billions of items of PPE. We could be far better prepared than we were last time. But at the same time, it's also clear to me that as soon as this as soon as the next one veers onto the horizon with any reasonable chance of becoming as catastrophic as COVID-19, you need to get ordering PPE.
But let's just be careful not to mix issues, Mr. Hancock. Over the course of the pandemic, that's not a reference to the stockpile, is it? It's one thing to stockpile PPE, if we're focusing on PPE.
Sure.
So that in the event of a pandemic, there is a reserve.
Yes.
And there are various policy decisions that go into the extent to which you do that.
Yes.
Or instead, the extent to which you buy in an emergency.
And have domestic supply, yes.
And have domestic supply. That relates to the stockpile.
Yeah.
Buying during a pandemic is something quite different, isn't it?
Yes.
Yeah. So when you say you can never stockpile enough PPE for a pandemic, you're saying it colloquially. That very much depends on what policy decision is taken as to the appropriate or optimal size of and type of a stockpile.
Yes.
And whether you want to buy in the emergency.
Okay, if I was to put it technically rather than colloquially, this is what I mean by saying you can never buy enough is, whilst it would be literally possible to store 100 billion items across the country, in the practice of government, with restrained resources in peacetime, it would be extremely unlikely to get authorization to do that and to be able to. And so in practice, one's future policy, this isn't a description of then at all, future policy should be to have much higher quantities of much better organized PPE than last time, but nevertheless, the moment you can see a pandemic being likely, get ahead of it and start ordering. In the description of what happened, we had, a medium stockpile, 1 billion items. It was not particularly well organised, and it was not easy to get out of the single factory, warehouse. But we were nevertheless right to get going buying early, because even with that decision, we saw how difficult it became.
And an important part of that process is the topic I want to move on to with you now, the early investigation of PPE supply chain resilience.
Right.
In which you were involved.
Right.
In February, you attended a number of meetings attempting to gain a clear picture of the threats to global supply chains for PPE. That's right, isn't it?
Yeah, I was worried from the end of January onwards about supply for PPE because my view was as soon as this became global, if we were trying to order as much as we could, so would everybody else be.
And you were right.
On that one.
You were informed that FFP3 respirators were recommended and you foresaw a surge in demand for those types of respirators.
Yes, it was blazingly obvious to me.
Was it not obvious to anyone else?
I don't know, but I was Secretary of State. It was obvious to me, and I pushed the system to try to act.
I wasn't sure if you were implying there that you had a battle on your hands to establish that point.
I don't think so, no.
No, all right. Public Health England had in stock 6.84 million out-of-date respirators that were being tested for shelf life extension. That's right, isn't it? It's in your evidence.
Thank you.
You instructed SCCL to increase its buying activities.
I did.
And you've mentioned a little bit about SCCL. They provided or supplied 250 main hospitals. They were. Do you want to say a bit about SCCL and what it did?
Well, SCCL was, from my vantage point as Secretary of State, where I wasn't involved in the detail of procurement until it became a crisis point. The purpose of SCCL was to have an efficient system of delivery of supplies to hospitals. And by efficient, you see, in normal times, that means carrying as little stock as possible. But in a crisis, that leads to lower resilience. And so the commendable drive in normal circumstances for value for money and for efficiency meant that when the pressure of a radical increase in demand met with a radical constriction of global supply, because everybody else's demand was going up too, the idea of having this just-in-time delivery system collapsed, and with it SSCL, and then some extraordinary individuals like Jonathan Marin and Emily Lawson, who've given evidence, stepped forward and put together the response. And the work that they did was absolutely phenomenal.
It wasn't until the 3rd of March of 2020 that you were provided with formal advice about PPE stocks.
Well, what do you mean wasn't until? We were discussing this in the department from January. I think this is an example of if you follow only the paperwork and you weren't there, you don't really understand the work that was going on.
Well, it's your 65. We can pull it up if you like. I was provided with further formal advice about PPE stocks on the 3rd of March 2020.
Well, there you are. Further advice. The bit of your question that was wrong was when you said it was only on the 3rd of March. I mean, that's the tonality of that is completely underplays the work that was.
When were you previously
Excuse me,
provided
I was finishing my answer.
Yeah.
Thank you. The tonality of that question completely underplays the work that was going on from the end of January until the 3rd of March.
Mr. Hancock, that wasn't its intention. I'm sorry if that was how you perceived it. When did you previously receive formal advice as to PPE stocks?
I don't know. It's not the question of formal advice. It's the question of what we were doing on the substance that matters.
Let's have a look at that. 65 then, and 66. The advice noted a range of problems of sufficiency, if I can summarise it in that way.
Yeah, that's a good summary.
How did that advice measure up to that you'd been given when you took up office, namely that the UK was one of the leading nations in the world in relation to pandemic preparedness?
Well, as I testified in Module 1, and indeed the inquiry found in its interim report on preparedness, the preparations that had been put in place were not adequate to the task. I mean, there was a much bigger problem than this, frankly, which was that the whole attitude to a pandemic was to allow the thing to wash over us and deal with the huge amount of death that would cause. And at this stage, as you'll know, no doubt from following other modules, I was not only dealing with PPE, I was dealing with other massive issues, the biggest one of which was trying to change the entire attitude to pandemic response to be one to try to stop the spread of the virus rather than simply deal with the consequences. PPE procurement was just one of many areas where that meant that we had to act differently to the inadequate plans that had been put in place a decade earlier.
It's one of the principal areas with which this module is concerned.
I'm sure. I'm just explaining the context because the necessary modular nature of this inquiry means that often context is missed in the questions.
You came to the view that the UK was going to run out of PPE in a pandemic. If we could have on the screen, please, INQ 000551276. It's an email from yourself of the 5th of March, 2020. On the constrained PPE market,
Yeah.
and stock position, I think that's a reference to you,
Yep.
notes concern that we will run out. As discussed in the meeting this morning, he is worried about this from a comms or public reaction angle. Can we prepare a comms package to mitigate potential negative public response? Presumably, Mr. Hancock, your primary concern was not
Yes.
a PR one.
Absolutely not, no.
Yeah,
I didn't write this note, but of course there would be a comms consequence, but the comms consequence would be entirely driven by the fundamentals on this one.
yeah, as one would expect.
Yeah.
You provide, if I may say so, a pithy summary of the position at that date at your paragraph 69 of your evidence, which I can perhaps just read out.
Can I, just before we move on,
Yes?
it is worth also noting, just so nobody gets the wrong impression, the final bullet here, we need, in the thing that was on the screen a moment ago, we need to ensure adequate supply. So whoever's written up the note has put the substance in there. It's just that you've only highlighted the bit about comms.
Right. The summary you offer at 69, as at this point, the situation at this time was therefore that the market for PPE and other medical supplies was exceptionally tight. We were in competition with every other country in the world for key items. Our primary source for these items, China, had put embargoes in place, and international air travel and freight, particularly from China, was disrupted. Points that you have more or less made in the course of this morning.
Yes.
Yeah. So that was the challenge faced at that moment.
Yes.
Early March
Yeah.
2020.
Yeah, and remember at this point, by early March, people were dying. It was clear that this thing was coming in a massive way to the UK. At the same time, we were dealing with testing, contact tracing, getting the vaccine going, and deciding what measures to put in place to stop the spread of the virus, keeping the NHS going at the same time. So for context, this is one part of a much wider set of actions that we were undertaking.
So I now want to turn to what you describe as the collapse of the SCCL supply chain. Mm-hmm. That is a description that you give at paragraph 14 of your evidence. You say SCCL was overwhelmed by demand and effectively collapsed.
Yes.
What do you mean by collapse? It continued to function, didn't it?
It was no longer able to manage the supply of PPE to the NHS.
All right.
I mean, others were closer to the detail, and again, you heard from Lord Bethell this morning, who gave a more detailed set of examples of what happened.
You therefore, let's have on the screen INQ 000551284, which is an email of yours from the 19th of March of 2020, with a lot of recipients, I see. Which starts, we needed more. I've been asked when I first became, sorry. This is the email in which you asked that anyone with testing capabilities be asked to come forward, and anyone with testing capability in line with standards to come forward,
yes,
such as universities.
Yeah.
So this is in March, 19th of March. This is before the call to arms that relates to PPE that comes later, isn't it? But it's an invitation for anyone who could help with testing capabilities to come forward.
Well, the context for this is that on the 19th of March, that was 2 days after I'd brought into the department responsibility for expanding testing. So the testing capacity, as has been frequently described, was very well stood up at a scientific level very early, but then PHE had failed adequately to expand testing and had failed adequately to engage with the private sector, and as a result of that, I had taken responsibility off them on the evening of the 17th of March, and this is 2 days later. So one of the things that we immediately did, that was in fact driven by Will War, was to go and find the testing capability, including, for instance, PCR machines that were distributed around the country in universities, and bring them into one place so we could optimise the throughput of tests. So that's what this refers to. It isn't. Doesn't really refer to a call to arms from my reading of it.
No. I said I'm going to move on to the call to arms, which takes place on the 10th of April later on.
Right.
Over the weekend of the 21st and the 22nd of March, DHSE officials developed the parallel supply chain, taking procurement out of the hands of SCCL and bringing it in-house to DHSE.
Okay.
Who approved that plan? Whose idea was it?
I can't remember at all. I may have ticked a piece of paper saying that we need to do this. It may have been a decision made at the operational level outside of my office. I can't remember.
Do you therefore, can you help us with why it was that the decision was taken to do this rather than support SCCL with further staff, contractors, seconded civil servants, and so on?
It's a perfectly reasonable question to which I'm afraid I can't shed any light. I don't recall the nature of that decision, but there must be a huge amount of paperwork around it.
And in hindsight, do you believe that that was the right decision?
I do, yes, because the pressures that we were under was absolutely overwhelming. SSCL had, as I say, collapsed, and simply the nature and the scale of the pressures were so much bigger than could be dealt with at the time, and it took us a couple of months to get from that position to back into a position of a structured ordering process. And no doubt we'll go on to some of the examples, but there was an absolute global scramble, and what the expansion pace that SSCL could have delivered was simply not fast enough, not least because their model didn't work.
So to those who say of this measure that it was the reinvention of a wheel, you would say the wheel was not fit for this purpose in any event?
That was my understanding, yes.
All right. Let's move on then to distribution of the stockpile. You say in your witness statement at paragraph 95 that on the 23rd of March, I formally approved a request from the NHS for military aid for PPE distribution. One of the problems at the warehouse where the PIP stockpile was stored was in deep storage in the northwest and not designed for rapid access.
Yeah.
So that we needed military assistance to physically get the stockpile to the front line.
Yeah.
That is put in rather more graphic or colourful terms in your pandemic diaries.
Yes.
Let's just see how you put it there. INQ 000 569 777. This is pages 6 and 7 of your pandemic diaries. It starts continuing to work. I don't think it's the bit that's highlighted there. Oh, there it is. Thank you. Continuing to work through practicality. Steve Oldfield updated me on the huge stocks of PPE in a warehouse in the northwest. 1 billion items. Just one problem. We can't get it out. It turns out that when they laid down the PPE stockpile in the 2000s, no one thought about the circumstances under which we might need it, i.e. an emergency, in which time is of the essence. It's in a huge storehouse unit which only has one door. Ergo, only one lorry can pull up at a time. This is a fairly basic or fundamental problem or error in judgment, is it not, Mr. Hancock?
It was certainly a massive problem for us, yes.
It meant that precisely the situation that this was put in place for was one in which it could not be, save with the assistance of the army, beneficially used.
No, that's wrong. It was beneficially used, but it could have been more beneficially used.
It was trickling out, wasn't it?
No, that is one of these terrible pejorative
describe
comments that
it?
you often make that's just totally inappropriate.
How would you describe it, Mr. Hancock?
It could not be picked as well and quickly as we would have liked and was needed in the circumstances.
We've heard from Mr. Webster on behalf of SCCL, who, by the way, took issue with the term collapsed. He didn't accept that SCCL had collapsed, but you've given your evidence on that.
Yes, and it's totally reasonable for the person running it to have said it hadn't collapsed, but for the purposes of what we needed and the massive increases scale, that is how it looked to me.
His evidence was that this warehouse was not designed to directly deploy stock to hospitals, but rather that the plan was to decant this stock to distribution warehouses. Was that also your understanding?
Well, in a way, it doesn't matter either way whether there was going to be an intermediary step. We couldn't get the stuff out fast enough.
What would you recommend be done differently to enable a better outcome in the future?
Well, what I put in place later in the pandemic is what we need in future, which is distributed stockpiles at every level. There needs to be a stockpile. So every care home needs a stockpile. Every GP surgery needs a stockpile. Obviously, every hospital needs a stockpile. Then there need to be regional, essentially, stockpiles. I don't mean that in the formal sense that there need to be 9 around England, but I mean they need to be distributed across the country. They need to be structured so that they can be picked, preferably automatically and using machines. There needs to be a data system so that we know exactly what's in it when its sell-by date is. There needs to be regular audits of that stockpile. We need, as I mentioned in the next sentence in my book, more of an Amazon-style approach to delivery. Now, they have a just-in-time delivery system too, and if demand for a particular item multiplied by 100 times in the course of a couple of weeks and went into global short supply, I'm pretty sure they'd have a problem too. It is inevitable that there are going to be challenges in the system when you put such colossal strain on it, but you can mitigate some of those in advance, for instance, by having a distributable and pickable stockpile.
SCCL was struggling with a surge in demand in January and February of 2020, weren't they?
They were struggling with the increase in demand already, yes.
Yeah. Do you think, again, on reflection, with the benefit of hindsight, that earlier deployment of the stockpile might have assisted matters?
Well, it's very hard to say that because we deployed it in January 2020, so it's hard. We couldn't really have deployed it much earlier.
All right, let's turn on to another topic I want to explore with you, if I may, Mr. Hancock. The call to arms, and by this I mean the PPE call to arms, the April the 10th call to arms. Yes?
Right.
Prior to the public call to arms in relation to PPE, which you made on the 10th of April 2020, the Prime Minister had made a call to arms for the provision of ventilators, hadn't he?
So I understand it. I can't remember the order of the dates.
Well, that may be the answer to my next question. Were you aware that this ventilator call to arms gave rise to very high numbers of offers of supply, many of which were non-starters?
Yes, of course. There has to be a triage system in any expansion of procurement.
Such that the team was struggling to assess those offers and to process them?
Of course, there needed to be a bigger team to do that, yeah. The size of the team was known when that call to arms was made, wasn't it? I imagine it was. I wasn't particularly close to the ventilator call to
All right. Well, let's
arms.
move
I
on to
obviously
the
knew
one
that it
that
happened and was involved in the discussion around it.
Were you aware that, in fact, many PPE suppliers answered the ventilators call to arms?
I no idea. I don't see the relevance either.
Well, let's move on and perhaps understand that relevancy. Your PPE call to arms came on the 10th of April 2020, didn't it?
It was the government's call to arms. I made it, yeah.
Whose idea was it?
I don't recall.
Not yours?
I don't recall. It might have been, it might not. Isn't that in the paperwork?
What was the problem that call to arms that you made, perhaps on your own account or perhaps on someone else's, was trying to fix?
We were short of PPE. We were radically short of PPE. The PPE was about to run out at a national level, and there were local shortages of supplies of PPE that we were aware of, and a lack of PPE has the potential to lead to death, including, and especially I was worried about, amongst health and social care workers. That's what the problem was.
Well, that's understood. Was there a shortage of offers of PPE that needed to be triaged?
We needed more offers to get more PPE, yes.
Let's turn to INQ 000536362, please. It's paragraphs 31 and 32. It's from the evidence of Sir Gareth Reith-Williams. Starts at around this time. There was pressure from the then Secretary of State for Health and Social Care and from Number 10 for a call to arms in relation to PPE. This was initially planned for the 20th of March, but then postponed to the 23rd of March, and then presumably it was postponed further until April. Is that right?
I don't recall. I haven't seen this evidence.
Do you know the reason for it being postponed?
Well, all I can tell you is here it says that Gareth, understandably, wanted a mailbox and a response team in place.
Yes, that's his paragraph 32.
Right.
It says, my office replied, he sets out various different things using a web form. He says it was necessary to avoid a situation again where people are sending emails all over the place.
Absolutely.
The request should specifically request details of specification, country of origin, and so on. And he says this towards the end of that bullet point. If it's anything like the response to ventilators, you will be inundated with offers, possibly even more, given some of the items are less technical than others.
Yes.
Yeah, and that is, in fact, what happened, isn't it?
We were inundated with offers, yes.
I know you followed some of this module today. Did you follow Sir Gareth's evidence?
I've seen a summary of it.
All right.
But I also recall talking to Gareth ahead of this, which was probably in that period, from between the 20th and the 30th of March, about how best to do this.
Let's just turn up that evidence in case you've not seen it, and for the benefit of others. It's PHT 0000150, page 50, where Sir Gareth is asked about the call to arms. But looking back, the call to arms was a mistake, wasn't it? It was counterproductive, to which Sir Gareth says, I can understand why it was needed, why politicians felt it needed to happen, but it had some very, very serious ripple, well, more than ripple. It caused huge problems, and a lot of the problems that the inquiry is rightly looking into, I think, flow as much from that as they did from our lack of stock to start with. So the question comes, it was an announcement that was counterproductive in terms of the challenges of procurement at the time. That's fair, isn't it? And Sir Gareth says, yes, the yield from the offers generated through the call to arms, rather than getting the industry into a room, which is what we did with ventilators, I suspect was marginal. Question, it's an example of ministerial pressure or ministerial interference proving unhelpful, isn't it? Yes, I wouldn't describe it as pressure. It was a decision that ministers took to engage the country against your advice, and then he says yes. Do you think, on reflection, and reflecting also on Sir Gareth's evidence, that there was any sense in which that call to arms proved to be counterproductive?
Well, it obviously led to more pressure because we were inundated with offers. The result of it was more PPE. And considering that there was such a lack of PPE, and we came, as you know, later within hours of running out as a country, I think a marginal, as he put it, even if it was only a marginal improvement in the supply of PPE, I would take it. And because my total focus was on saving lives. I understand that it caused more pressures in the buying team. And it is absolutely true that ensuring that we have as high quality triage as possible in any system is necessary. And I've no doubt that now that there is lived experience of what happens in these intense high pressure situations, that sort of triage system, which I wasn't involved in designing, could be designed better. But there's a big category error in this line of questioning that you put. And the category error is that it was a mistake to want more offers. What we needed was the best quality triage to get the most PPE that we could. And so having reflected on it and I did see this part of Gareth's evidence, and Gareth, by the way, did an absolutely extraordinary job. And it's true that the call to arms we made put pressure on him and his team. But I cared more about getting more PPE because we were all working all hours that God sent at this point. And nobody has testified that the PPE calls to arms led to anything other than more PPE. And indeed, it's in Gareth's testimony. And more PPE saved lives. So I stand by it.
Let's just pick up on that point before I turn to those pressures to which you refer. When you say it resulted in more PPE,
yes,
it's not possible for you to know what level of PPE might have been procured without that call to arms, is it? It's simply not possible.
You would have to argue that more offers of PPE led to less PPE for it to have had a negative impact, and that is hard to believe. Not least, Gareth's evidence was that there was an increase. He calls it marginal. I don't think that's the case, but an increase, any increase, was worth having at the time.
You mentioned the pressures. Let's turn to those. There was a call centre set up to deal with the backlog of offers, wasn't there?
Yeah.
MPs were escalating offers from time to time, weren't they?
Yeah.
Suppliers were threatening to go to the media with complaints.
Yeah, and phoning up the Prime Minister. I mean, there was absolute. You've heard the what I've called the pressures. The whole series of consequences of those pressures. Yes, and by the way, these were happening before the call to arms as well, because it was so obvious that the country needed more PPE. You know, I had the head of the Royal College of Nursing, somebody who previously had owned a pub in my village, the editor of the Daily Mail, Martin Lewis from Money Saving Expert. I had all these people contacting me saying, we've got kit, can we help? That's what happened. And that happened because there were huge pressures of supply, and because it was so obvious to everybody that unless you did everything you could, more people would die than otherwise. So people were coming forward with life-saving propositions, and we needed a system to deal with that. And my job, total focus across all of the different parts of my portfolio, was to save as many lives as possible, right? That was my total focus. And, the end result of that was enormous pressure on all sorts of supply chains. We're primarily talking about PPE, but right across the board. We had to get as much in as we could. In some cases, we paid expensive prices for that, but I think that was worth it to save lives. And in the end, on PPE, we over-succeeded, right? We procured more than was needed, and had to, I'm sure we'll come to dealing with the oversupply that we had at the end.
We will. Lord Bethell, to whom you referred and from whom we've heard evidence earlier today, says in his evidence that the teams dealing with the main route for referral via the portal were indeed swamped by unsuitable offers. You wouldn't disagree with that?
Of course, there were huge amounts of offers. Also, I'll say this. We knew when we went into this that some of the offers would be inappropriate or indeed fraudulent. And you'll have seen it, because I'm sure you've read all of the paperwork. There are references that were made within the meetings to ensure that we dealt with those sorts of proposals that were unhelpful, as well as obviously the proposals that were brought forward that were helpful. But the normal PPE supply chain was totally inadequate to the task that was needed. And the consequence, these were life and death consequences of whether we got more PPE or less.
And Nigel Boardman's review, with which I'm sure you're familiar, are you?
I contributed, I was interviewed for the review, but I wasn't particularly close to it.
Concluded that a number of organisations and individuals who were well-meaning but lacking the necessary competence responded to this call to arms and made the task of identifying the best likely sources of PPE more difficult to identify.
Yes, of course that's true, and some people came forward with fraudulent propositions, but the overall result was more PPE, and my job was to get as much PPE as possible.
So let's step away from that for a moment and just reflect on how the exercise might have been done better.
Okay.
I think you touched on that a few moments ago. Well, let me pose that initially as a completely open question.
Okay.
Yeah.
So I'm, off the top of my head, but having reflected on this obviously over the years, the number one thing is that the industry and the suppliers who are already incumbents need to be properly and fully engaged as aggressively as possible. Okay, they are likely to be the core of the response. Secondly, bringing other suppliers who are already supplying those materials into your supply chain is absolutely vital. Third, trying to encourage others with the capability to pivot to very specific demands with clear specifications is absolutely vital. Fourth, you do need to leave open the proposition for creative proposals and creative solutions, especially from credible players. Layer on top of that the fact that a very large proportion of PPE was bought internationally, and this was part of a lack of resilience as a country that was there before the pandemic, and still is there to a lesser degree now. You needed the international element of this. So, for instance, one of the things we did early in this stage was we pivoted much of the action of the civil servants, Foreign Office civil servants who worked on the ground in China, to helping to procure PPE. Then you need a triage system, and you do need to triage for two different things. You need to triage for initial assessment, and you need to triage for chasing. And you need a process that those who are approached, whether they chose to be or not, can put a proposal so that it can be adequately purchased. All of this needs to be done whilst removing the standard rules that slow down this process enormously, which are necessary and proper in normal times, but are not adequate in these times. That's both the extremely rigorous checks, for instance, on background of suppliers, on the details of the shipments, and also on the price point, because the UK government has a standard procedure to go for a low price point, but when the price is moving up, that just means that we couldn't buy PPE easily because of those standard rules until the Treasury rightly suspended them for this period. So you've got this global demand, which is extraordinary. We've heard testimony of shipments being taken off being bought from us whilst they were being loaded into planes to come over to the UK. You have political involvement in every country around the world. The idea that this could just be done independently of ministers is not only wrong and unconstitutional for domestic reasons, but it was totally impractical. So there was one example where we were desperately tight about to run out of one particular item. I think it was gowns, I can't quite remember, at a national level. We got a supply from Turkey. Unfortunately, the fact that supply was coming got into the public domain, and understandably in Turkey there was a public outcry, why are we shipping off our PPE? And that supply was stopped on the tarmac when we'd sent the RAF out to pick it up. So all the questions that I've heard and the questions that I've responded to both at the inquiry and many, many times before, including in some of the court cases around this, far too often completely fail to understand the sheer scale of the challenge and the pressure. And so you have to put yourself in the mindset of what actually is going on at that time, including the real world pressures. And these aren't political presentational pressures. This is people dying, in order to then design a system that procures as quickly as possible. And Paul Dighton did an amazing job at getting that straightened out as things calmed down over the summer. But the one other thing I'd say, and this pertains to your questioning and this inquiry, is that you also have to protect the people who are making decisions at great speed, because some of the integrity of civil servants who gave their all in that time has been impugned since, and I fear that it will be harder to procure PPE in the future, because people will look at the treatment that some of the people involved have received, including some of the sort of undertones of some of the questioning, and think, I'll just run a mile in future. Whereas instead, what actually happened in the pandemic is people leaned in, and that's what you need in a crisis of this scale.
Mr. Hancock, you've given a very long answer, but it's my fault because I asked an open question.
Yes, feel free.
But there are, I'm sure, helpful parts to it. I just want to ask you about some of it.
Yeah,
in summary, you would advocate for, you would recommend a more focused approach to procurement, but allowing for that pivot aspect, i.e. to the possibility of suppliers that were not conventionally manufacturing, say, PPE, but could do so.
And creative potential solutions that you haven't thought of as well. Yes.
Yes. So far as the protection of those, so to speak, on the factory floor, those toiling hard to
To buy the kit.
To buy the kit, who
Yeah.
are procuring
Yeah.
long hours.
Yeah.
You refer to possible adverse effects of the inquiry or the media in terms of those individuals. I want to ask you about the protection of those individuals within this process at the time.
Absolutely, that's important too, yeah.
Now, you say that there should be triage for assessment and for chasing.
Yes.
Should they be separated?
Well, they necessarily have to be connected because you need to know. So the precise details of the design of it, we could work out in slower time, but it is necessary to have both, and there needs to be a connection between the two of them. For instance, I've heard the chair ask previous witnesses, would you go for this traffic light system? Well, the traffic light system is a high priority, medium priority, and low priority triage. We, in the end, had a high priority and everything else triage. There isn't much difference between the two. What you need to do is design a system that has triage and allows for interrogation of where things are up to. And they do need to be connected, but I'm sure they could be designed as efficiently as possible.
Mr. Hancock, what you've not referred to, but I'm sure you would agree would need to form a part of this, is the smart use of data.
100%.
The arrival
vital.
at an early stage of all the data that is necessary, or as much as possible of the data that is necessary to form a view on an offer.
Yes.
Front-loaded into the system.
Absolutely. And knowing that the progress of any particular offer is updated accurately in the system, so anybody chasing could just go into it and say, well, this is where it's up to. Yeah.
So what you have described or what you have recommended is different to what came into being.
Of course, because we had to design it from scratch.
Absolutely, and a large part of the purpose of this inquiry is to learn lessons.
Yeah.
You say in your evidence that you were not involved in the setting up of the high priority lane.
Sure.
It follows, I think, from the answers that you've been given, that with the benefit of that hindsight, you wouldn't reinvent it. You would invent something that was better, that was more effective.
You need something, right? So, as Secretary of State, before or after a public call to arms, irrespective of a public call to arms, as Secretary of State, I received proposals. And as I'm sure you've seen from all of the paperwork, what I did with those proposals was I pinged them onto the system. In the first instance, I sent almost all of them to Jonathan Marren. In some cases, I would send them to private office or Lord Bethell, particularly if somebody was being particularly difficult, to be honest. But if it was a plain vanilla offer, I'd send it to Jonathan Marren, and then when I heard about the setting up of the high priority lane, I would ping it onto the high priority lane. You do need a system for that, because when an offer came to me, it would have been a dereliction of duty not for me to pass it onto the system.
You do need something, absolutely. I don't know whether your following of this module included early on in week one when Professor Sanchez-Graells gave his evidence. His evidence with which, on this point, no one has disagreed, is that there is no equivalent of the VIP lane to be found abroad or in the devolved administrations. Do you know of one?
There are endless examples across government when in particular, an MP or a minister has a challenge, a request of government, that they are able to get a response to it. Lord Bethell referred to the scheme for Ukrainians. There are endless.
Not quite my question, Mr. Hancock.
It is my evidence is that it is absolutely standard practice across government. So I was not at all surprised when one of these was set up.
Let me re-put my question. We're talking about the context of procurement, and we're talking about whether, within the experience of the pandemic, it is possible to find abroad or in the devolved administrations. I'm not focused on Ukrainian refugee allocation, accommodation allocation.
Well, you may not be, but you say within the confines of this module, and as you know, this is a challenge of the modular approach. It is absolutely standard in the UK government to have a process for the triage of requests.
Do you know of an example of emergency procurement in the pandemic of a VIP lane of the type that existed here? elsewhere?
Every single country had a process to try to buy more PPE. The evidence, which I heard it on the Today programme rather than the inquiry, I thought was completely flawed, because the problem with some of the analysis around this, and we've had it in some of the other evidence, is that it tries to pretend that these were normal times. You know, there was a court case back a couple of years ago where they found that some of the paperwork was filed in public a couple of weeks late, and that was deemed this great catastrophe. It wasn't a catastrophe. People were choosing to save lives instead. And the reason I'm answering your question in this way is that I think it's a entirely subjective view as to how different countries responded to the problem, that people would contact ministers and others, like MPs, like senior civil servants, like senior clinicians, and say, I've got an offer, and what you need to do is get that offer into the system as quickly as possible. And it's become this great big thing, and frankly, we're going to have a system to do something similar in the future. I've no doubt that the next time there is a pandemic, people will email the then Secretary of State, and she or he will need a system to be able to send the requests they receive onto. It's an inevitable part of life.
Your own system, Mr. Hancock, would have that person feeding into
a triage,
a data-fed system, information about the offer that would populate a live platform.
Yeah, but there you go again, discussing a perfect world. Absolutely, we should design a better data-driven system for the future. Of course, better use of data would be a far better way of doing this in the future than essentially starting from scratch and from then building it on a spreadsheet. But the problem is, the reason I've answered in this way is that, frankly, the questioning on it has been wholly naive to the circumstances that we faced.
Let's just
Hancock, could you just... I think you're seeing hostility in the question.
I certainly am. It's totally understandable.
Will you let me finish, please?
Oh, sorry.
There isn't hostility. It's about what could we do better in the future, understanding what the system was like, what all the pressures were like. I can assure you this isn't about saying, oh, well, they should have had this perfect system in place, it's all their fault. You could argue they could have done more by way of preparedness. You've accepted that. It's about how can we do it better when the next pandemic comes. So it's not intended to be hostile.
Thank you for clarifying that. What I would say is that that is how I took the questioning when I was being asked how to do it better in the future. When then asked a question specifically about has anybody else in the world done it this way, my answer, I suppose, my considered answer is every country will have, I don't know what these systems were like, but every country will have had some kind of system for dealing with this problem. And forgive me for being impassioned on this point, but I have been subject to enormous amounts of conspiracy theories about what went on here, when in fact what happened was so many people working as hard as they could to save lives, and they bought more PPE as a result, and therefore people are alive who would otherwise be dead. And frankly, I'm incredibly proud of the people who themselves have felt under attack because of the way that questions have been put, which does have a material consequence on future responses to a pandemic.
Mr. Hancock, it's only right that you should have an opportunity to respond to the part of Professor Sanchez-Grael's evidence that relates to this. I'm just going to put it on the screen and invite you, I'll read it and then invite you to comment on it, all right? It's INQ 000539153, where Professor Sanchez-Grael expresses his view on the VIP lane. In my view, it says at the bottom, it says no.
It says turn it off and turn it on again. That's a new one.
Was it?
Just read it out.
Oh, OK, I'll just read it out. In my view, the VIP lane also fell short of several applicable requirements and is problematic from a broader perspective. The reasons for its creation are unpersuasive, as there were alternative measures that could have been put in place without creating preferential treatment at triage stage. there was no consideration given to the risk of de facto differential treatment that the pressure stemming from regular requests for updates and the labelling of offers as VIP could have, or potential confusion as to what VIP signalled. There was no consideration of the fact that a referral by ministers, MPs or senior officials was not a justification for preferential treatment. Do you wish to comment on that paragraph?
Well, at one level, I of course agree that a reference of from who an offer was triaged through doesn't impact automatically the likelihood of that being worth pursuing, but it does have some informational value. And what I would say about that particular paragraph that you read out is that it is wholly naive as to the circumstances that we face. And I believe that Mr. Gove gave some pithy evidence as to his view of this particular bit of evidence in the inquiry, with which I wholly concur.
Certainly, he did comment on Professor Sanchez-Grael's.
But the point about naivety is really, really important, OK? It's fine having academics write papers about this stuff. And some of the academic analysis of how you could do better in a future pandemic is really, really valuable. But it can only have any value at all if you understand what it was like. You know, you weren't there. This professor wasn't there. But you've got to understand what it was like. And that's why I'm trying to get this over. The pressure to save lives is intense, but so is the reality that high-quality offers will come through and be sent through to senior decision makers. And you have to have a process for dealing with that. I didn't design this process. I've no reason to defend it, but I do care that this is done well in future. And I didn't care if an offer came through me and somebody had to go back and say, I'm terribly sorry, we're not taking this one up. I didn't care either. And there's loads of paperwork of me just saying, well, please go and tell them appropriately, right? What I cared about was getting PPE. And I worry, and the reason I keep repeating this point, this emphasis, I worry that well-meaning but naive people are going to get this wrong for the future and leave more bureaucracy in a future emergency procurement than is relevant at the time. And then the Secretary of State at the time will set that aside and we'll end up having to invent something from scratch. If we're going to invent something now, let's invent something that is going to actually work when the proverbial hits the moving object.
Mr. Hancock, you also care about the protection of those involved in emergency procurement.
Absolutely.
Yeah. And one of those individuals was Chris Hall.
Yes.
Yeah. And we know from his evidence, perhaps we could have it on the screen. My screen seems to have come back to life. Is yours functioning,
yes.
Mr. Hancock? Great. INQ 000536 369. He is, in this part of his witness evidence, talking about complaints about particular offers that have been made, delays in the system.
Yeah.
He says ultimately 624.
Yeah. Tell me about it.
Or was it 625? Ultimately, many of these complaints would be referred back to the HPL mailbox by the official or minister who had received the complaint. This simply added to our existing workload and required time to investigate and to explain to hard-pressed ministers who had in fact happened, what had in fact happened and why the offer had not proceeded further. Now, if we can move from there, thank you for that, to INQ 000527 557 and page 2. There's an email from Chris Hall. And then if we go up to the top of this, Alan Nixon says, thanks, Chris. Mammoth effort from you, your newly established team, and I really appreciate the note setting this out. We'll keep trying to insulate you and your team from things like this, unless absolutely necessary. Problem was, this one came direct from Matt, who I assume is yourself.
Yeah,
Hancock.
that would have been me, yeah.
And he'd asked for an answer on it. I've spoken to him and he's happy,
Yeah.
as is the MP.
Yeah.
So it's an illustration not just of the pressure or the increased pressure that is brought to bear on those, and we touched on this earlier at the end of your quite lengthy answer, Mr. Hancock, how to protect those individuals who are working hard and long hours to achieve what they needed to.
Yeah.
This is an example of where you yourself are contributing to that additional pressure. Is there any way out of that?
There needs to be a system that takes this into account. Please zoom out.
Yeah, you want to see above that?
Because I want to see Chris's response.
Yeah,
all good, and we really appreciate the support we're getting from Matt and the political team, right?
Yeah.
So absolutely, I would refrain from putting this kind of pressure on unless there was a good reason to do it. For instance, if the particular chasing came from somebody who we were also in discussions or negotiation with on some other matter, then it would have a material consequence. So you've got to have a system that takes this into account. And this is why I disagree with this assessment that such a system didn't exist anywhere else in the world. That can't be true, right, in my experience. I haven't been a minister in any other government, so I don't know directly, but I can ask some of my colleagues who were. These sorts of pressures exist in reality. If we try to design a system to pretend they don't exist, or worse, to say these pressures exist and what we're going to do is tell the senior people stop putting this pressure in place, then it will fail, right? I would not have gone to Chris with a request unless there was a good reason to do so. And that's why I respond in this way, is because my motivation was to get as much PPE as possible. I was also at the same time dealing with a dozen other subject areas, and I had to make decisions as appropriate. Senior leadership sometimes involves asking what's going on in one area because of something important going on in another area. And so you do need a system that deals with this, yes. And you can't just say, let's just ask people to ignore those pressures because they are real.
All right, Mr. Hancock, let's move on from the VIP lane. You anticipated that we would come to excess PPE or overpayment for PPE. I want to do that with you now, if I may. Mm-hmm. You said in your witness statement at paragraph 16 that the procurement teams, as we've been exploring, were under immense pressure, and that in those circumstances, you don't expect everything to be perfect, so that when action was taken that can later be criticised, for example, overpaying for a consignment of PPE, you don't apologise for a minute, because you had one goal, and you said this several times today and in other modules, and that was saving lives.
Yes.
You say, while of course theoretically there is a limit to this approach,
Yes.
we were nowhere near it.
Yes.
And would you apply that to both prices paid for and surplus amounts of PPE and other urgently needed medical kit?
No, I think that refers only to prices paid, I think, in what you read out from what I said. In terms of oversupply, obviously, what you want is the perfect quantity, right?
Yeah.
That's obvious, but it's also extremely hard to deliver.
Yeah.
My instruction to the team and my bias, and by the way, it will be the bias of whoever is health secretary next time there's a pandemic, is more rather than less. And they achieved more rather than less. The oversupply was rather larger than I anticipated, but it is better to have more, to err on the side of more supply, because if you err on the side of less, then you run out, and we got very close to that.
I think Sir Christopher Wormold said that he would rather be sitting there saying that we had too much than that we had too little.
He's absolutely right.
Yeah. When you say that your own view is that we rather oversupplied, can you say by a factor of what? I mean, did you form a view as to how much of an excess it was?
No, it's very hard to say because, firstly, by then Paul Dighton was running PPE supply and doing it brilliantly. Secondly, it depends how much you can put into a future stockpile. So I was asked in 2021, for instance, to dispose of some of the PPE, and my view was that we should put it into a future stockpile, not dispose of it. But that's a difficult and very practical matter, what can be stockpiled, where it is. And so there's an important administrative task of dealing with an oversupply. Exactly how much was oversupplied is actually impossible to tell, because it all depends on what you can do with it.
Well, we'll come back to that. I just want to go to the previous point, which is pricing.
Yes.
And you're quite right. The bit that I read out was relating to pricing, but I wanted to ask you about both aspects at the same time. Let's turn to INQ *000 88616 and page 6 of it. The minutes of the 20th of April 2020 COVID-19 Strategy Ministerial Group.
Yes.
This records you as saying that the current rules state that the government should buy at 25% below market value. Was that the position at the time?
That is the standard normal times position of Treasury in terms of public sector procurement.
Well, clearly that's unachievable in a crisis such as this.
Correct. And when I brought that to light of Rishi Sunak as Chancellor, he removed that rule.
He said that we should buy above market value in order to become a go-to customer for global suppliers of PPE.
Yes, there were stories, I don't know whether they're true or not, of the CIA turning up with literally truckloads of US dollars in China in order to buy a kit. We didn't do that, but that was the sort of thing that we were dealing with. And you've heard other stories of losing supplies when they were on the tarmac. I mean, so... And when a price is rising, if you're trying to buy below par in a rising market, you just get nothing at all. So that rule was a problem for a period, but as soon as it was brought to the Chancellor's attention, he suspended it. It is, of course, totally reasonable in normal times.
What did you envisage it being necessary to do to become that go-to customer?
To pay above par.
And how much?
That was entirely a matter for people on the ground.
You've made reference at numerous points in the course of today to the fact that you had many responsibilities within your department: vaccines, therapeutics, IPC guidance, test and trace, and so on. All of them required some form of budgeting, didn't they?
Yes.
So you presumably needed to keep a close eye on that which was budgeted for, say, PPE procurement, and ensure that there was enough in the coffers to allow for other expenditure?
No, that's not really how it worked in the pandemic. Because of the extraordinary circumstance, as a department, we were able to draw down on the Treasury Reserve, and indeed the Treasury issued a huge amount of debt in order to pay for these costs. So that the management of that was, obviously I cared about how much money we were spending, but I thought that was second order to stopping the pandemic and keeping people alive. I essentially delegated the day-to-day management of that challenge to David Williams, who, of course, engaged with civil servants in the Treasury. And frankly, the system they put together was exceptional, and they are exemplary in their service. I only got involved when something then needed to be escalated to ministerial level in Treasury.
We'll come on to the relationship between DHSC and Treasury in a moment, and we've heard some evidence that relates to that. Steve Barclay appeared earlier in this module.
Yeah.
But I just want to ask you this point. In a minute of a meeting of the 21st of April, so the following day, you indicated that the government needed to take a dynamic approach to pricing and be willing to take on extra risk.
Yeah.
What did you have in mind there by extra risk?
Oh, to be able to pay above par market value. So my attitude, I basically took a risk-on attitude to many areas in the pandemic because of the scale of death that we were facing. I took a risk-on attitude to legal risk. I took a risk-on attitude to making decisions that may not have had the formal minute. I referred somewhat grumpily to your reference of the first formal advice I had in early March on PPE procurement. That's because we weren't doing formal advice at this point. We were getting on and buying stuff. So I took the risk-on attitude here was to be prepared to pay above market value, which normally I would have been pretty aghast at. I was the Minister for Efficiency before I was the Minister responding to COVID, and so I found it quite uncomfortable, but it was necessary to save lives.
It wasn't the risk of over-procuring.
At this point, I was not worried about the risk of over-procuring because we were desperately short. That became... I think the question's referring to about April, May 2020. The risk of over-procuring hove into view later.
Okay. Let's just pick up on this point that we, as I said, we heard evidence from Steve Barclay.
Yeah.
He, along with Lord Agnew, who did become a Minister for Efficiency and he had various other roles,
As well, yeah.
expressed a degree of frustration at the sums that were being asked of the Treasury at very short notice.
Yeah.
In fact, Mr. Barclay invited the inquiry to seek evidence from DHSC as to why such little notice was given.
Yeah.
I think both of those witnesses felt that by the time they'd received the request, given the short timeline, it wasn't possible to apply
Normal levels of scrutiny.
Normal or even any meaningful level of scrutiny. Lord Agnew refers to a particular request for 1.25 billion with a turnover time of 24 hours.
Right.
So can you comment, can you help the inquiry as to why the deadlines imposed, even for sums as large as that, were so short? Because
we were in a desperate situation with, you know, this. If you're referring to something, I think in about May 2020, there were just under 1,000 people a day dying, and we had no idea how long the pandemic would go on for, and there was a high degree of scepticism as to whether a vaccine would be successful. So sometimes actions needed to be taken very quickly. As I say, I understand those frustrations. They're natural frustrations for a Chief Secretary to the Treasury and a Minister for Government Efficiency in the circumstances. I wouldn't have been close particularly to the individual procurements or spend because I wasn't close to any contracting other than on vaccines. And really David Williams was the person I turned to for those questions. They were, as you say, exceptional circumstances. The normal rules, regulations, norms did not apply as between DHSC and the Treasury. Rightly so. You say that you told Sir Chris Wormold that we deal with any legal headaches later and the primary goal above all else was to save lives. And that's a phrase I think you use. Let's just turn up the document, INQ 000550. That's 10 and 11 of your statement, I think. There you go. Pages 10 and 11, I beg your pardon, it's para 48. Yes, what did you have in mind there, the legal headaches? Oh, for instance, if the statutory declarations is a good example. You know, there are a whole series of. As Secretary of State, you inhabit a world constrained by a statutory and common law framework, which is entirely right and understandable. In normal times, working through that can be frustrating, but is proper. And there are some ministers who rail against it more fulsomely and publicly than I do. I actually think that working within the rule of law to get stuff done that is basically the job of leadership as a Secretary of State. And if you really don't like the law, then you have to seek permission to change it, and that takes time and brings in further constraints. That is how you operate. That is the statecraft of being a cabinet minister. When you have a calamity of this scale facing you, when you realise that you are going to be the Secretary of State facing the first global pandemic in 100 years. And when you know that the death toll, if you don't act and lead, is going to be in the hundreds of thousands, the estimate in January was 800,000 people dead, then you are prepared to lean into that and deal with, as it says, legal headaches later. What mattered was appropriate action to save lives, and that is what we did. I'm just trying to focus on my question. You said
statutory
Declarations, yeah. So, I mean, I'm referring to the court case I mentioned earlier.
contract award notices.
Contract award notices, is that what they're
This
called?
is the notices of what the procurement awards that have been made.
And we're a couple of weeks late with some, and there was then a case about it, and the whole thing was ludicrous.
Yes, indeed. And you had that. Well, I'm not sure that it was ludicrous, but I understand what you're
That's my evidence.
you're referring to.
Yeah.
That's what you had in mind, is it? Or
Yes.
Or anything like that?
That sort of thing, yes.
All right.
I can give you another example. We had to change the law with the Coronavirus Act in order to remove a whole series of restrictions that made it difficult to act quickly. So that's another. In that case, we changed the law.
Well, Lady, I see the time. I'm very close to the end of this topic. I'm in your hands.
Yes, I think we'll break now, and I'm issuing a warning to all advocates. The inquiry has given an undertaking to the last witness of the day that he can catch a flight back to Northern Ireland. He will get that flight if I have anything to do with it. That means that all advocates are going to have to think about restricting their questioning, and we will finish Mr Hancock before the afternoon break, and we will finish evidence today at the very latest by 4:30. Thank you.
Bye.